So you have your patient, they have like an 8 or 10 French per chole tube in. Take me through that approach to get them to the stone retrieval ultimately.
Typically, we're replacing a 10 French drain primarily. Some patients do come in and they have an 8 French or an 8.5 French drain. I have seen cases where if you try and upsize from an 8.5 French to something like a 16 French, that there may be a fair amount of bleeding. And then that becomes challenging because then you have this hematoma in the gallbladder and it can actually envelop the stone and then you can't see it and it's hard to remove it. In that case, if it was an 8 French or an 8.5 French, then probably would do a serial upsize. Within the workflow of these patients, they get the drain initially, and then ideally you'd see them back between like 6 weeks and 3 months. And hopefully within that time they've had, they've recuperated from whatever acute episode they've had, but B, they've also been able to follow up with surgery to see if they're a surgical candidate.